Hello everyone. Now I'm going to discuss about syndactyly. Syndactyly is a condition in which children are born with fused or webbed fingers. About half of children with syndactyly have it in both hands or it is bilateral. Most of the time, syndactyly affects the fingers. Sometimes it affects the toes, but not as often. While any two or more fingers can be joined, syndactyly most often occurs between the middle and ring fingers. The fingers might be connected by a flap of skin that looks like webbing, and in other cases, the fused digits might look almost like a single finger. Syndactyly is fairly common. It affects about 1 out of every 2,500 babies. The condition tends to affect boys more often than girls and white children more often than black or Asian children. Symptoms of syndactyly differ depending on the type your child has it. There are three types of syndactyly: simple, complex, and complicated. As you see, simple syndactyly is when fingers joined by skin and soft tissue only, whereas complex one is when there is underlying bonds are joined together. And complicated syndactyly is when there is extra bones and abnormal tendon and also ligaments that attach the two fingers. When we see what causes syndactyly, during pregnancy, a baby's hands form in the shape of paddle and later split into separate fingers. This happens very early, around the 6 to 8 weeks of pregnancy. Syndactyly happens if two or more fingers do not separate during this time. Syndactyly often runs in families, and about 10 to 40% of children with syndactyly inherit the condition from a parent. In some cases, the condition is part of a genetic syndrome such as Poland syndrome or Alpert syndrome. Regarding diagnosis of syndactyly, syndactyly is often diagnosed at birth. Sometimes it is detected even earlier on a prenatal ultrasound. We may also use X-rays to assess the underlying structure of your baby's fingers and determine a course of treatment. We should have to also evaluate baby's arms, shoulders, chests, feet, head, face to look for signs of other abnormalities that we have said above, since it might be a genetic syndromes. The other issues about the treatment of syndactyly. Syndactyly is treated with surgery to separate the joined fingers when they are between 1 and 2 years of age most of the time. During surgery, the skin is split evenly between the two fingers, and a skin graft or skin substitute to cover the newly separated finger is needed. And skin grafts are usually taken from the elbow or wrists to minimize scarring. After surgery, the child will wear a cast or bandage covering their hand, lower arm, and elbow for 2 to 3 weeks. This will keep their hand still and protect the healing skin. And once the cast comes off, they will wear a splint to keep the fingers apart for 6 weeks. And occupational therapy to reduce scarring, manage stiffness and swelling, and improve function is also recommended. Thank you for your attention. Don't forget to subscribe to the channel.